Leukotriene inhibitors. So first, let's talk about the normal function of leukotrienes. Leukotriene is released, which is a mediator of inflammation. So a lot of times, an example would be allergic reaction, or let's say asthma. So then it's a mediator of inflammation, and then it also causes bronchoconstriction and mucus production, therefore causing some coughing, wheezing, shortness of breath, and also regular allergies, some runny nose. Based on what we know about the normal function of leukotriene, what would leukotriene inhibitor do? Since we know how it works normally, now if we inhibit it, we basically block the immune system response of the leukotrienes, which then will decrease the inflammation, prevent bronchoconstriction, and prevents mucus production. So the effects of leukotrienes are much more limited to the lungs. What are the therapeutic effects of leukotrienes? Based on what we know of how it works normally, when we're using leukotriene inhibitors, the effect would be prevention of small muscle contraction, and it helps decrease inflammation. So it decreases bronchoconstriction and decreases mucus production. It works three ways, right, in the respiratory system. It decreases inflammation, decreases bronchoconstriction, and decreases mucus production. Indications or reasons why patients are on leukotriene inhibitors are controlling with chronic asthma and possibly seasonal allergies. Sometimes it can be from of prophylaxis so that they don't get asthma attack from seasonal allergies, and often it is a long-term treatment and prevention of exacerbation of asthma. So a lot of the times when a patient is on it for a week, that's when you start seeing improvements of symptoms. And I myself take this medication and I decided to stop taking it just because, I take it to prevent allergy-induced asthma. That being said, our air quality has been bad. There's a lot of pollen, so I had to restart my medication just a couple of weeks ago. And now I can really feel the difference. I'm not as congested, and so I can breathe better. It's one important piece of education too, because then some patients, when you start them on the medication, they may complain, well, it doesn't work for me. I took it yesterday. It's very important to let them understand that it takes some time for this medication to take effect or to feel the effect of the medication. So it's important to wait. So a minimum of 1 week, but for some people, it may take longer than that. Certain precautions when taking this medication is liver dysfunction. So like a lot of our medications, they're primarily metabolized in the liver. And contraindication, obviously, if we know that there's already some precaution when it comes to liver dysfunction. Now, if somebody has liver failure, that's definitely a contraindication, as it's going to be difficult for the body to metabolize the medication. Some common side effects: headache, dizziness, insomnia, GI upset, and nausea. In addition to that, some people actually complain of like having weird dreams whenever they're on this medication. And I can tell you that whenever I take this medication, I do have some interesting dreams. Not always like weird, but it's just usually I don't remember my dreams. But when I'm on this medication, I do remember what I dreamt about, and which is so interesting to me. Now, some nursing actions. Definitely, we want to monitor for therapeutic effect, side effects, and we know that it's contraindicated and it's a precaution on liver dysfunction or liver failure. Then we want to monitor for the liver function or liver function test. Patient education, again, it's important to educate the patient regarding the dosing, and then controllers. So educate the patient to take this every day, not as needed, because some patients will just take it as needed, and make sure we educate them and tell them that they have to take this every day as ordered by the physician in order to control their symptoms, and to take it even if the symptoms have already improved, because a lot of times they stop it and guess what? Their symptoms will come back, because that's the only reason why they're not being symptomatic. Examples of drugs in this class would be your Accolade or Zafirlukas, Singular or Montelukast, and Zyflo or Xyloton. The most common one prescribed is Singular or Montelukast. This is the one that you have to know. And the reason for this is this has less or very little reported adverse reactions when patients are on this medication.